There are now 8 provinces reporting more than 429 B117 variants and 28 B1351 variants and 1 P1 variant. At least 3 of these provinces are reporting evidence of community spread, and variants have been linked to outbreaks in various settings. To tackle this latest hurdle, we need to keep doing what we've been doing, but with even more diligence to counter these more contagious variants. This means keeping up individual public health practices at all times to limit the spread of the virus, protect people and populations at highest risk, and allow time for vaccine programs to expand to protect all Canadians. We continue to make progress on the vaccine front. To date, almost 1.2 million doses of COVID-19 vaccines have been administered across Canada. And based on data up to February the 6th, over half, 55.4% of prioritized healthcare workers, over 31% of adults in the territories, and 11.6% of elderly adults over 80 years of age having received at least 1 dose of COVID-19 vaccine. Federal, provincial, and territorial authorities are working closely together to monitor vaccine safety. As of February the 5th, there have been 651 reports of adverse events following immunization to date. These include any medical event that occurs following immunization, but isn't necessarily related to the vaccine or the immunization process. 99 of these reports to date, about 1 in 11,000 doses administered, were considered serious, such as a severe allergic reaction. All adverse events are subject to review. All serious events undergo a detailed investigation to determine whether or not they are related to the use of the vaccine. Information that indicates a potential link between the use of a vaccine and a previously unknown health event or a health event with incomplete information is considered a safety signal, which warrants appropriate action from the regulator. To date, no unexpected vaccine safety issues have been identified. Today is the Lunar New Year. During COVID-19, as with all our celebrations, keeping everyone safer means we need to limit in-person interactions to our immediate household to maintain our important social connections with extended family, friends, and our community. Reach out with virtual celebrations where there are no limitations on how many or how far we can reach. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. There have been 817,163 cases of COVID-19 in Canada, including 21,088 deaths and 37,747 active cases across the country. Disease activity continues to decline nationally, with an average of close to 3,350 new cases reported daily over the past week. Severe illness outcomes are also on a steady decline. Over the past week, an average of under 3,050 people with COVID-19 were being treated in Canadian hospitals each day, including 688 in critical care, and 82 deaths were reported each day. These past weeks have been very challenging, but we've made great progress and are now almost two-thirds the way down this curve. We can all gather strength from the fact that our collective Canadian effort got us here, and that we have some strong tools in the form of COVID-19 vaccines to light our way to a brighter future. However, we will need to keep putting the brakes on the spread of the new virus variants of concern in Canada. There are now 8 provinces reporting more than 429 B117 variants, 28 B1351 variants, and 1 case of P1 variant. At least 3 of these provinces are reporting evidence of community spread, and variants have been linked to outbreaks in various settings. To tackle this latest hurdle, we need to keep doing what we have been doing, but with even more diligence to counter these more contagious variants. This means keeping up individual public health practices at all times to limit the spread of the virus, protect people and populations at highest risk, and allow time for vaccine programs to expand to protect all Canadians. We continue to make progress on the vaccine front. To date, almost 1.2 million doses of COVID-19 vaccines have been administered across Canada. Based on data, up to February 6th, over half, or 55%, 0.4% of prioritized healthcare workers, over 31% of adults in the territories, and over 11% of elderly adults over 80 years of age having received at least one dose of COVID-19 vaccine. Federal, provincial, and territorial authorities are working closely together to monitor vaccine safety. As of February 5th, there have been 651 reports of adverse events following immunization to date. These include any medical event that occurs following immunization, but isn't necessarily related to the vaccine or the immunization process. 99 of these reported to date, about 1 in 11,000 doses administered, were considered serious, such as a severe allergic reaction. All adverse events are subject to review. All serious events undergo a detailed investigation to determine whether or not they are related to the use of the vaccine. Information that indicates a potential link between the use of a vaccine and a previously unknown health event, or a health event with incomplete information, is considered a safety signal, which warrants appropriate action from the regulator. To date, no unexpected vaccine safety issues have been identified. Today is the Lunar New Year. During COVID-19, as with all our celebrations, keeping everyone safer means we need to limit in-person interactions to our immediate households. However, to maintain our important social connections with extended family, friends, and our community, reach out with virtual celebrations, where there are no limitations on how many or how far we can reach. Thank you.
Merci, Dr. New.
Thank you, Dr. New.
We'll now open the lines to questions. As usual, we ask that you please limit yourselves to one question and one follow-up. Alors, nous allons maintenant passer à la période des questions.
We will now move on to question period as usual. Please limit yourselves to one main question and one follow-up question. You may ask your question in the official language of your choice. Operator, over to you.
Merci. Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour toute question. Notre première question est de Raymond Fignot de TVA.
First question, TVA. Please go ahead. Thank you. Question. Dr. New, do you fear a third wave? Answer. Thank you for the question. It is difficult because there are different definitions for first wave, second wave, and third wave. But for my part, I think that, yes, we really do have to be cautious because these new variants are of concern, and it is quite worrisome. We can see that there are several cases now in several provinces, and we know that these new variants are more contagious, which is why we must redouble our efforts with public health measures that have already proven their worth. And continue to collaborate with public health authorities in all levels of government. Now, there's things can be done at the personal level too, and people really need to continue to limit the number of contacts that they have. But we do continue to see some community spread that is concerning, but so far it's going fairly well. And as you can see, the number of daily cases has dropped substantially over the last weeks. And we hope that trend will continue.
est-ce que les variants pourraient faire en sorte
Could these variants
l'éventuelle troisième vague soit pire?
make the third wave even worse, in your opinion?
C'est difficile parce qu'il y a plusieurs
Answer.
facteurs.
It's difficult because there are several factors that come into play. We're starting to vaccinate people now, and it's very important that
Au fur et à mesure, beaucoup plus de Canadiens
as we go through that, and as more and more Canadians get vaccinated, the rest of the population, because most of the population remains susceptible to this virus, so it's very important to keep up our efforts. So it is difficult because we're working with two different factors. We're continuing to vaccinate the population, but at the same time, we must not let our guard down with when it comes to public health measures. So yes, it is possible. And we have to keep a close eye on what these new variants are doing. Now, we have a network of laboratories across the country, including our national laboratory in Winnipeg, and so we're continuing to analyze samples that we receive to try and identify variants. And when we find new variants, we have to move forward with strong community measures and public health measures and local public health measures, as well as rigorous contact tracing. So there's a great deal of work to do on all parts to continue to keep a close eye on what's going on with these new variants.
Merci. Prochaine question.
Thank you. Next question.
Merci. Our next question is from David Lundgren from Reuters, Ottawa. Please go ahead. À vous la parole. Mr. Lundgren, your line is open. You may proceed with your question. We cannot hear you at this time. If you are on a speakerphone, can you pick up the handset or unmute your line?
Maybe we can move to the next one and come back to David. Here's David.
Oh, sorry about that. I do apologize. Dr. Tam, the head of Air Canada this morning said that he expected by the end of April, quote, there'll be an improved dynamic with respect to testing, replacing to some degree quarantines. Is this a concept that you have discussed at all?
Well, I think it's obviously premature right now to know what is happening at the end of April. Everything is determined by our collective action, as we've just said. But what I think is important is that with the pre-departure testing, and I think you will hear later on, there's a technical briefing on border measures, that if we lay down the appropriate mechanisms to test travelers, then the testing becomes a tool that we can use to look at how we can safely have people come in. And so it is an area that we would continue to look at. What will be important is to collect the data that we're going to have as we test people coming in. And that data will be very valuable in informing us what to do. For example, not just the arrival test itself, and particularly picking up variants, etc., but later on, in this phase, we're going to be collecting a swab from people later on in the quarantine period. And that kind of data will certainly help inform us as to what the path forwards could be.
And what would you need to see for you to recommend that the process, that the practice of quarantining ends for incoming passengers?
So right now, the period of quarantine is 14 days, and we know that that's really important. We started some pilots with Alberta, for example, Ontario, and others. And so that's the data that we have to look at. With the variants in the mix, I have to say that is sort of it's thrown us another challenge. We want to make sure we know what the behavior of those variants are, in relationship to when the quarantine period is the most suitable, given that they might behave differently. But let's say this is a 14-day quarantine period. What we would want to see is that, the same with the Alberta pilot that we've had in place, that we will be able to tell if people, what's the proportion of travelers that remain positive, for example, after a number of days. So some of the protocols that one could look at may be, what right now, because of the variants, we're going to be testing people near the end of the quarantine period to make sure that it is safe for them to leave quarantine. But some of the protocols might be like if you tested, like in the Alberta pilot, in the middle of the quarantine period to see if people are positive or not and how many you catch. And you might be able to, if someone then has a negative second test, be able to let them move on. And so those are some of the protocols that we have been studying ahead of the variant situation. And now we just got to see what happens, as I said, with the swab and the testing that is going to yield us some information upcoming. But it is a matter of, we do know that people are mostly infectious around that 5-6 day period during that incubation period, and that the majority of travelers, if they're going to be sick, are going to be manifesting that around the middle of that quarantine period. So those are the sort of parameters that we'll be looking forward to, and that will help inform our future policies. But I think just having the infrastructure in place to know how we can test travelers will, I think, be really helpful in the future state in terms of setting up testing to allow travelers to come in a safe manner.
Thanks.
Thank you. Merci. Prochaine question.
Thank you. Notre prochaine question est de Juliane Lapointe.
Our next question is from Radio-Canada. Please go ahead. Question. Hello. I'd like to know, there are French experts talking about the fact that these variants couldn't reinfect people who had already had COVID. Is this a conclusion or a fear that you share? Answer. I'm not sure I understood your question. Could you repeat it, please? Yes. Question. So some experts have said that with these new variants, it may be possible that persons who were already infected with COVID become reinfected with these new variants. So we're talking about vaccination, we're talking about trying to manage all of this. Are you afraid that people who already have had COVID may become reinfected with these new variants? Answer. Well, certainly the science and research is continuing to evolve with all of these new evidence we're collecting. But even before, with previous variants, we knew that it was possible, and we don't know how long immunity lasts. If someone has had COVID-19, it is possible to become reinfected, which is why we have thought in the past that if someone had COVID-19, perhaps 3 months later, it is possible, if someone goes for another test and gets a positive result, that may be a case of reinfection. And that's even before the new variants. So it's just as possible with the new variants that there may be reinfection, since we have seen that phenomenon before these new variants emerged. So it is a matter of concern. And I believe that these new variants are quite worrisome, as we know that these variants are much more transmissible. And the strong public health measures do work. But as we've said, we have to look at things on the population scale as well as on the individual scale. Follow-up question. Yes. Can you tell us what the numbers might look like given these new variants for these isn't it inevitable that there will be more and more cases, especially since certain regions are starting to open up again? Answer, yes, modeling experts in each province, but also at our own experts here at the national level are continuing to review the evidence to see what is possible, what the possibilities are. If we continue, however, or should we continue with lockdowns? Which public health measures should we continue? I think that as early as next week, Dr. Tam and I will be presenting some of that modeling, some of those modeling results. But for now, I can only tell you that it's very important for everyone to understand that given these new variants, which are a new factor and lend even greater importance to redoubling our efforts. So we're beginning with vaccination, of course, but most of the population remains susceptible to these virus and variants. So as we're waiting for our turn to become vaccinated, we must continue to keep up public health measures. We're moving in the right direction right now, and we do hope that we will continue to do so. But if we let our guard down too soon, especially with these new variants, of course, we may see much higher case numbers.
Merci.
Thank you.
Prochaine question. Next question.
Merci. Next question is from Kevin Gallagher from CBC News. Please go ahead. À vous la parole.
Good morning. I have a question about rapid testing. Yesterday, Dr. New talked about, federal officials giving kind of like a briefing to provinces about sort of best practices, how to use these rapid tests, knowing that many provinces are not using them. Also, provinces expressing concern about the effectiveness of these devices. I'll bring up the BD Veritor as an example. Many provinces are just not using them. Manitoba has said that they're at big concerns. They're looking into them. So why has this recent sort of explainer to provinces about best practices for rapid tests only happened recently? What is the holdup, it seems, for provinces to get these devices out, and how best should they use them, especially with the concerns of a third wave?
Should I start? Maybe I'll start quickly since I was referenced in terms of my question coming yesterday. What I would say is it wasn't, a special primer. We've actually put out guidance in terms of the best use of, more specifically, when we talk about rapid tests, we're talking about the antigen test. There are also point of care, a molecular test, but I think most people, when we talk about rapid tests, are focusing on the antigen tests. And if you look back, we actually published guidance in terms of the best use of antigen tests several months ago. And as the provinces and are gaining experience and so on, as well as laboratory experts across the country, including those in our National Microbiology Laboratory, we were actually updating the guidance because one of the questions I think that was being looked at was, could the antigen test results be, quote, used on their own, or how could or should they be used in conjunction with sort of the molecular test as, quote, a confirmatory test? If you have a symptomatic individual, and you get a positive antigen test result, could you just stand by that, or did you need to do a molecular sort of a test confirmation? How about if you do screening of asymptomatic individuals? When and how could or should you be using PCR testing? So that guidance has also come out, and I think based on obviously the evidence we've accumulated to date, I would still say there's a very important place for antigen tests. We've said it repeatedly, and that still stands from what we said several weeks or months ago about using it in certain contexts. For example, ongoing screening, especially in long-term care facilities. We know that that's a very high-risk setting. Certainly looking at a program in which you consistently maybe test, be it visitors, staff, residents, that's certainly one very important use. And certainly other types of workplace settings, such as meatpacking facilities, or settings where there's very sort of tight quarters between the workers and the chance for very rapid propagation transmission. So those are the types of situations, and the guidance has been updated. And I'm not sure if it's actually been posted yet, but certainly within sort of the technical experts, both laboratory and public health, we've been well versed, and provinces, I think, are getting comfortable with the antigen tests, and certainly we're aware that several provinces are now rolling them out in a much more systematic fashion to be used in settings such as long-term care facilities. Thank you. Dr. Tam?
Follow.
Yeah, I'll just add that there is the tests are evolving over time as well. One of the use of antigen tests is this repeat testing, because we know that they don't perform as well as the PCR, but if you have the opportunity, such as in certain high-risk settings, to continuously screen, that increases the performance, or reduces the gap between the performance of the molecular and the antigen tests. One thing, I think, a new development that has, I think, really helped provinces to try and put them out is the use of a nasal swab instead of a NP swabs for some of these tests. Because you imagine if you keep doing repeat tests and these tests are NP swabs, it doesn't take long for people not to really comply with that kind of an approach. Whereas newer modalities to collect the samples, I think, has also helped. The other thing is just sharing information between jurisdictions, whether it's Nova Scotia trying it in downtown Halifax for their outbreaks, being shared across the country, and I think that's been very helpful in terms of getting people started. The other thing is that the federal government's also looking at different collaborations with private sector entities and workplaces as well to maximize the use of these tests.
Follow-up?
But I think the real question is why aren't they being used? I mean, we know that it's a fraction of the percentage that provinces, they've received these tests. They're sitting in warehouses, I should say, storage centers. It's a real small percentage of the actual tests that are being used. Why aren't they being used on a more regular basis?
Well, I think you may want to pose that question to the different jurisdictions, but based on the sort of latest roundtable with the jurisdictions, they are beginning to deploy them in various settings that includes not just long-term care, but really in shelters, for example, for homeless shelters, as well as in certain workplaces. So we know that is what some of them are doing and accelerating in terms of their application.
Merci. Prochaine question. Next question.
Thank you. Notre prochaine question.
Next question. Please go ahead. Hello, can you hear me well?
Oui.
Yes. Dr. New, I'd like to know these variants that are being tested with sequencing and tracing. In Quebec, we want to increase these tests to 10%, even perhaps a little more, according to our health minister. Is that sufficient to find out what the trends are and be able to deal with them?
Okay, merci pour la question.
Answer. Thank you for the question. Yes, I think that is a good approach at the beginning to aim for a certain percentage, as you said, 10%. But I don't think it's just the number of tests or samples collected that we need for tracing, but also to really target certain settings that present a higher risk. For example, I think it's a good idea if a case is detected with a returning traveler. It's very important, if we find such a case, to do contact tracing and figure out if this is a variant that arrived from another country, or if there's a case that has to do with an outbreak outbreak. And we can see that many of the contacts are associated with that first case. That's another example and another circumstance in which it's very important to do contact tracing to see whether it is linked to, and sequencing to see if it's linked to a specific variant. So not just in Quebec, but across the whole country, it's also very important to see whether there's an impact on the vaccination programs. So if there are cases in which we know that the person has already received a dose of the vaccine, it's a very good idea to do sequencing to see if this is a case of a certain variant. So I think it's good to assess all kinds of different approaches and adopt all kinds of different approaches to try to identify cases of new variants, not only in Quebec, but across the whole country. Thank you. May I add something? Yes, please go ahead, Dr. Tam. I'd like to add something. At the beginning of this year, we did sequencing and had about 5 positive cases. So 10% or 5% of the cases. So 10% is a good increase. But an important thing for provinces to do as well is to identify specific mutations such as N501Y and 501Y, so that has to be done as quickly as possible. Quebec, Ontario, and the other provinces have a goal of detecting specific mutations in most of the positive cases. Thank you. As a follow-up question, last year, March break is still going to happen in some provinces, but Ontario is delaying it. Should it be delayed everywhere or cancelled because these new variants and spread may coincide with the third wave?
C'est Dr. New.
This is Dr. New. Answer. Yes, I'll begin. This is a current issue. I think the decision made by Ontario, in principle, we can appreciate the logic, given what's taking place currently in Ontario, of delaying the March break. It's a good idea, and it will help limit the number of contacts during that week as much as possible. If people take that holiday a little later, it'll be closer to spring. Perhaps there will be more opportunities to spend time outside and all that. I can't speak for Quebec. I think the public health authorities in Quebec have undergone their own analyses of what's going on across their province and in each of Quebec's regions in making that decision. So I'm sure they're monitoring the situation, and they may decide eventually to make a different decision, but it's not for me to comment on that decision by Quebec at this time. Thank you. Thank you.
Merci. Prochaine question. Next question.
Our next question is from Cassandra Scarsley from the Canadian Press. Please go ahead. À vous la parole.
Undergone their own analyses of what's going on across their province and in each of Quebec's regions.
Miss.
In making that decision. So I'm sure they're monitoring the situation, and they may decide eventually to make a different decision, but it's not for me to comment on that decision by Quebec at this time. Thank you. Thank you.
Next question.
Our next question is from Cassandra.
Oh, hello?
Scarsley.
Yes, Cassandra, go ahead, please.
Please go ahead. À vous la parole.
Undergone their
Hello, sorry, I'm having trouble hearing you. It seems that the downward trend in Atlantic Canada has reversed course. There have been very concerning outbreaks in Newfoundland, obviously, especially among younger people and high schoolers. I'm wondering if anyone there can elaborate a little bit more on, I guess, this shift and this what that poses for the projections in Atlantic Canada in particular.
Yes, I think obviously you would have to talk to the chief medical officers in those provinces, but I've been in touch with them closely. You're correct in that, for example, there is an outbreak at the moment in Newfoundland in the St. John's area that really seems, the demographic seems to be younger people and associated with schools and social or sporting events. So I think it's obviously a reminder that if public health measures are not in place, this virus can accelerate, and including in young people, and they are susceptible to the virus. And these social contacts are, and these kind of settings, as we all know, can be a source of spread. Particularly older kids have can transmit the virus. We've seen similarly to adults, and so that is something that we already know. So I think the authorities in Newfoundland have been very quick to implement much more restrictive and stringent public health measures in the area of the outbreak, including, of course, putting schools online. And they are doing widespread testing, and which is how they're finding these cases. And so I think that is critically important. So I think it's just to show that even in jurisdictions that have experienced very few cases, that spread could still happen. The most important thing is to rapidly get some, rapid public health measures in place, and the testing, contact tracing, and isolation protocols. As it stands, there are no hospitalizations that we have heard from Newfoundland, for example, which is in line, of course, with the demographic at play. But I think much more importantly is that society is not segregated in terms of age groups. So if you had a younger person whose maybe family members work in healthcare, and that healthcare worker goes into a long-term care facility or a hospital or a high-risk setting, spread can actually occur in those settings for which severe outcomes will occur. So I think the vigilance must continue. This is a really delicate period, as I've said in prior briefings. It is almost the most difficult period of time. We need the vaccines to roll out at the same time as maintaining stringent public health measures. Otherwise, I think, pointing to one of the earlier questions, which was actually in French, is that look at the European countries. They give us a clue as to what might happen if variants are circulating and we let our guard down, and that massive acceleration into that third resurgence, if you like. We don't want to talk about ways. So resurgence will happen really fast. So this is the time to be vigilant against the variants.
Well, following that, it sounds like a third wave driven by the variants is an inevitability. So to what degree can that be slowed by aggressive vaccinations?
I think, first of all of the public health measures are important. And we've talked about all of those. And really be very cautious about easing public health measures at this time while vaccination is just beginning to accelerate. What we've observed in other countries is that it's those public health measures, even countries that have had quite high levels of vaccination, they've had to put in more public health measures when these variants are circulating in the majority of cases. So I think that is what's going to happen. But vaccination will catch up to the variants if the vaccines remain effective. So escalating vaccine coverage is an extremely important part of the response right now. So yes, I believe they will play a part, particularly right now in preventing severe outcomes. We've yet to see what might happen in terms of reducing transmission. But I think, the vaccine is an extremely important tool. We'll be looking at Israel and the United Kingdom and others very closely. But really, the bottom line, though, is that they still needed all those public health measures. And even with that relatively high vaccination rate, so that teaches us something.
Thank you. Next question.
Thank you. Our next question is from Olivia Stefanovic from CBC News. Please go ahead, à vous la parole.
Good morning. When will the Public Health Agency of Canada update guidance on masks, given that the CDC endorsed double masking and your agency says non-medical masks are sufficient?
Yes, so we just posted some updates as well. And I just want to clarify a few points about those recommendations. The most important things for all Canadians to remember is that effective masking means a well-constructed, well-fitted, properly worn or well-worn mask. So well-fitted, well-constructed, and well-worn. And our advice has been on non-medical masks. And based on our research and evidence review, 2 layers of a cotton mask together with an additional filter, such as polypropylene, when is well-fitted, provides a level of protection that can be similar to a non-medical mask, especially one that is not a non-medical mask that is not well fitted. So the US CDC, I think, put out some guidance really to try and clarify and to educate people on the use of medical masks, surgical masks that people might be able to access, is that they actually often don't form a very good fit. So their recommendation, which I think is great, which is, you can tie a knot and tuck in the edges of a medical mask to make it fit properly. The other measures that they tested in a laboratory situation is to put a non-medical mask over the medical mask, which does a couple of things, but main is so that it fits really well. And then there are, other frames of fitters that can make a medical mask better fitted, and or putting even a nylon sock, I believe, on top of the medical mask, because just to make that better fit. So I think that our recommendation remains in that a well-fitted non-medical mask, particularly with that filter in place, is a very good option for Canadians. We also have messages which is permissive on the use of medical masks if they can be accessed, particularly if you are at high risk of medical conditions. If you have someone who's sick in your home, you're looking after them or putting the mask on the actual sick person. So, but I think anything that can be done, including the US recommendations to have a better fit for any mask that you have, is the way to go. Just to emphasize that masking is an important layer, but one layer of protection. It's not going to do everything, but together with avoiding, the 3 C's, closed environments, poorly ventilated, close contact for prolonged periods of time is really important. And maintaining physical distancing. So masks cannot do it alone. So I think that we've been messaging, the fewest interaction with the fewest people for the shortest time, for the greatest distance possible, is the way to go when you're tackling not just the previous COVID, but the new variants as well. So I believe we have that updated information. It could have been yesterday, just to emphasize how people can do that proper construction and fitting.
Thank you. As a follow-up, there are calls from some doctors for Black Canadians and other vulnerable minorities to be given priority access to vaccines as new doses arrive. What is your view about directing vaccines to racialized Canadians who have been disproportionately exposed and infected with COVID-19?
That's a great question. And the National Advisory Committee on Immunization is currently examining the next set of prioritized populations. And if you bear in mind some of the underlying rationales or principles or objectives is to reduce serious outcomes, but also to reduce the burden of illness and looking at places like congregate settings, etc. Absolutely, I think provinces have different demographics, but they use the evidence, I think, to inform their vaccinations. For example, if you were in Toronto or if you're in Ontario, they've already got data in relationship to where those higher risk populations are, and that they be considered as part of the rollout for the prioritization of vaccines. But all I can say is that I know that the National Advisory Committee on Immunization has been hard at work, and then we expect that their recommendations will come very shortly.
Thank you. We have time for one more person. On a une question de suivi d'une dernière personne. Opérateur, à vous la parole.
Alors, de nouveau, appuyez sur étoile 1 si vous avez une question. Please press star 1 if you have a question. So we have no further questions registered at this time. Oh, pardon. Nous avons une question d'un participant.
We have one final question.
So we have a question from Justine, Radio-Canada. À vous la parole, please go ahead.
A question from Radio-Canada. Please go ahead. Yes, good morning. I would like to know, the French health authorities, which is the equivalent of Health Canada in France, is recommending that only one dose of the vaccine be given to people who've already had COVID. Will you be making similar recommendations? Answer. As Dr. Tam said in response to the previous question, I think we are impatiently awaiting the experts' recommendations from our National Advisory Panel on Immunization. So they are currently looking at the issue of priority populations to be vaccinated, as she said. But the question that you've asked is another one that they are currently discussing. So we await their recommendation on that as well. But generally speaking, I can tell you that yes, if someone has already had COVID-19 and therefore has a certain level of immunity, obviously if we have a limited number of vaccines available, that is a consideration, possibly giving the doses to vaccinating someone who is completely susceptible to infection. But as I said, we impatiently await our experts' recommendations. Thank you.
Dr. Tam, quelque chose à ajouter?
Anything to add, Dr. Tam?
Alors, peut-être une question de suivi?
A follow-up question?
Non, c'est bon, excellent.
No, that's fine. Thank you very much.
D'accord, merci.
Thank you.
This concludes our press conference for today. C'est ce qui complète notre conférence de presse.
This brings today's press conference to an end. Thanks, everyone. Have a good day.
The latest updates there from federal officials, and we're going to bring in our Evan Dyer, who's waiting for us in Chelsea, Quebec, talk about this. Evan, some strong words there from Dr. Theresa Tam, a really delicate period, about the most difficult, talking about this nexus between vaccines and the variants. Can you tell us what stood out for you?
Well, the phrase third wave certainly stands out, and it's one we've been hearing in the last few days. You know, some parts of the world have already been through a third wave. The United States, for example, has certainly been through a third wave. Its third wave began way back in fall of 2020, but Canada is now looking at the potential of a third wave perhaps peaking or beginning to peak around April. And this is simply based on the fact that we know the new variants are in the country. We heard there something like 400 new variants found yesterday. So if the new variants have a higher R number, in other words, if they're more transmissible, then new variants eventually displace the older, less contagious variants, and they drive up the rate of spread of COVID-19. And you can mathematically model that out. And it looks like, barring vaccination campaign, of course, it's a race between the new variants and the vaccines. Unless the vaccination campaign ramps up, we may be looking at a third wave, which will be not only medically difficult, but also politically difficult, because it's going to be coming at a time when some of Canada's allies are already quite far ahead in their vaccination campaigns, including the United States, which has declared open season in April. Dr. Fauci saying basically any American will be able to get a vaccination by that point.
Evan Dyer, Chelsea, Quebec, thank you so much, and we'll talk to you a little later.